closing amount. All right, good evening. All right, good afternoon, everybody. It's February 24th, I think it is. Am I right? Is it the 24th? All right, 24th here in Green Bay, Wisconsin. Yes, things are quite amazing, as always. Had a great weekend. Hope everybody had a great weekend. Just doing my thing this weekend, which relates to my business question of the day and stuff, so it's kind of cool. I had a question, like I said, just for a question and answer, just to let you guys know, for you guys that have a question about some health topic, make sure to put it in the comments. We have Christy, we have Trinity, we have Hunter, we have Justin here, and probably Dr. Allen will probably join us soon. But if you have a question, put it in there, and I'll see what I can do on there just to give you a little bit of guidance that way and everything, just some ideas and information that you can take and hopefully make your life better. If you do need help, please go to thewellnessway.com, find a clinic, look for someone to take care of you. I do not take care of patients that way. And that leads to our question. And say, Doc, I looked at your stuff. You own a lot of things and do a lot of things. So then do you still see patients? And what do you do all day long? Okay. Great question. Do I see patients? No. No. I have so many doctors that have to do their stuff. I kind of stay out of it that way, just because I saw patients full time for basically 20 years, and then about 3-4 years after, I cut down more to part time, and I built my other companies while still seeing full time patients for 20 years. And was it difficult? Absolutely. That's why I learned to time manage really well. And then as I moved out of patient care, I kind of run obviously the businesses that I do own, but I spend a lot of time obviously on media and doing certain things and promotion and just sharing some ideas and stuff like that. Obviously then I run Wellness Way as a corporate structure. That's a huge venue right there. Now, do I have a person that runs the Wellness Way itself? Yep, her name is Nicole Seidel. Do I have people that run my real estate? Yep, that's Uriah Stutzman. Do I have people that run my other companies? Absolutely. I'm still the CEO of over all them, so I spend more time with the leaders of the companies than anything else and stuff. So you put great people in place and you let them do their job really well, and then you keep on investing in them and grow them, and they grow their teams and everything, and then it goes from there. So I pretty much spend most of my time with the leaders that I have that run the other business stuff that way. Now, once again, why do I do question and answer as far as healthcare? I do a lot of interviews. It's because clinically, I've done things for a long period of time, so therefore I have a lot of experience, and so therefore if somebody wants to see me, I don't see them, I have my other doctors see them. Just like, for example, we have wonderful doctors here at Green Bay, one doctor is Appleton, one doctor is across country that way, and they can take care of people. So that's why I kind of laugh when people, it's really funny because I get attacked constantly, especially if I talk anything about past COVID stuff or things like that. And I kind of laugh a little bit because the whole idea of media is good information that way. And if you don't like I say, it's okay. I'm cool with it. I'll be just fine and stuff like that. And that's why it's like, you can't cancel me. I'm not your gym membership and stuff like that and everything. Actually, most people want to cancel me. They belong in the gym because they're pretty fat and ugly. It's usually fat and ugly women and stuff. It's not a joke. It really is. And so I can say it. It's kind of funny. It's usually some liberal, some fat, ugly woman that would never have a voice in anything in life anyways and stuff. And you say that's derogatory. No, you want to pick a fight? Let's pick a fight. But you want to get in a debate? And so let's pick a debate. You know what I'm saying? And then share ideas and see who wins. So I've done my whole career and stuff. I'm not your gym membership. You can't cancel me. Even with now with Biden out and a lot of the censorship stuff gone, there's a lot of people that think they can stop you from saying it. It's called free speech and stuff like that. It's like, I can say what I want to say. I'm going to say what I want to say. What's the worst that can happen? Somebody complains, big deal. You say, I've dealt with complaints, not from patients. I've never had a patient complaint ever. But see, that's the thing. I don't take care of patients right now, so it's easy for me to not do certain things. So, what are you going to do? Report me to the state or something, and then you're going to take me off media? Not happening and stuff like that. So, state doesn't control our media and stuff. So, that being said, that's what to my business question. That being said, let's pop in. And what do you got for questions there, ladies?
If baker's yeast and brewer's yeast are on my allergy list, can I have things with nutritional yeast in them, or should I be avoiding all yeast?
Well, here's what happens. If you have those yeasts that are continuously popping up on your lab, it means that you eat too much sugar, okay? And I would just make sure that you are not suffering from hypochlorhydria. I would try to avoid as much as you can, just because there's a sugar issue. I'd be taking some CY complex, which is Saccharomyces boulardii, which is actually a yeast that helps combat some of the overgrowth of yeast. But what I would do is I would actually look at more avoiding sugar than anything else.
Would you use Albizia for sleep at night?
Would I use Albizia for sleep at night? There is a positive benefit to sleep, but it wouldn't be something I'd directly use. I'm using Albizia more for the counteract the over production of histamine when your immune system's being triggered. But of course, if it does calm down the histamine response, there is a little bit benefit to sleep. But I would actually look at some other things like L-theanine or California poppy or even valerian before I think of Albizia for sleep.
My mom is 80, osteoporosis in her neck. What is the best treatment for her?
Well, at 80, there's probably some other health issues really going on. But what I do is make sure that she has good vitamin D, but especially K2 levels. I would be having her take some extra K2. I'd also make sure that her estrogens are doing well, because estrogen, vitamin D, K2 have a very big influence on those. But I would actually be looking at a lot of K2-based products as far as food, and also maybe some supplementation. And then, everything's about lifestyle. Keep her inflammatory things down.
This is an interesting one. I was just wondering, to get rid of belly fat, can you use chia seeds with water? Does that really work? I never knew that.
Well, if the chia seeds, I love the fact that you're trying to get some good fiber and certain nutrients from chia seeds. And there's a bolus that's actually created to help, move things through the GI tract that way. But if you're really looking at losing weight, focus on proteins first, because you still have to get yourself in a calorie reduction. But I would say even having good proteins, having chia seeds are fantastic, because I'm a huge fan of chia seeds due to the fact the fiber content, the insoluble and soluble fiber that you can get from them. And there is some really good nutrients within chia, but I'd actually focus on more on proteins if you're looking to lose weight. And you gotta remember, it's gonna bring your sugar levels down, which could change your cortisol levels, and maybe that's why you have some belly fat.
Suggestions for varicose veins in active middle-aged men.
Well, varicose veins in active middle-aged men, that means probably got a little obesity, probably got to reduce your sugars dramatically. You want to take some Neo 40 for the nitric oxide. There's chronic inflammatory things that are why the vessels are bad. And so it's really not about taking anything. It's got to dramatically change your lifestyle, bring your blood sugar down. The person probably has some obesity they probably have to deal with first.
What are your thoughts on the castor oil craze?
I think castor oil has massive benefits, so I don't know what the craze is. I don't see a lot on media. I don't consume a lot of media. I do much more produced media. I would say that castor oil has massive benefits, especially bringing hydration to certain areas. That's why they do see a benefit when they put it, over the liver by the GI. Ladies, you can put it on your face, you can put it on your hair, and it hydrates the skin. So I don't know if it's really a craze. I think that there's great benefits to castor oil.
What would you do with chest pressure going on post-influenza A?
With chest pressure and post-influenza A, first of all, I'd be doing things to support your lungs, like OSHA, Albizia, nettle, and then I'd look at, building my immune response back up with like turkey tail, echinacea. I make sure I also have elderberry to actually help with some counteracting some of the influenza that's been documented to show. Hunter, can you grab me a Zevia? I need something to drink. I want a little Zevia to drink on. Yes, I am fasting, just to let you guys know. So it started last night after my meal. So I'm hungry right now, but that's okay.
Just wanted you to know that Dr. Jessica Jansen at the Wellness Way Eau Claire is the best. Absolutely changed my life.
Jessica is amazing over in Eau Claire with Dr. Jordan and Dr. Tristan and Dr. Morgan. They're all amazing. Yes, that's one thing. That's why people say, Doc, why don't you see patients? I actually loved patient care. I actually sometimes dealing with a bunch of these morons out there, I can honestly tell you, 20 years I never had any complaints, ever in my life. I've still never had a patient complaint ever, not once. Okay, but here's the point. Okay, then COVID came along and all that stuff, and it was kind of funny. And then I deal with dummies because you have media, and actually we do reach millions of people every single year. And you're never, I kind of laugh. People are like, don't you get sick of people attacking you and stuff like? No. Whenever you do something that's different than the norm, if you ever look at it this way, they've been finding fraud and abuse with the government agencies right now. And there's still a lot of people that are upset about that. Do you understand how dumb you are? You are an idiot. I own a lot of companies, and if there was misuse of funds and fraud, you'd want to fire those people or get rid of it and stop it. It's almost like you guys are that dumb, opposing a government agency trying to clean up all the wastes and stuff like that. And it's really funny. Or the ICE. Here, I got to say something about this. I want you to think about this. I really want you to think about this. If you know anything about history, if you ever look at like all the immigration stuff, Tom Homan, you are a hero. You are a hero. Let me say it again. You are a hero. God bless you. I pray for you every single day. I pray for my wife and my girls first, but I pray for Tom Homan. I pray for President Trump. It's really funny, guys. It's not funny. I even prayed for President Biden, not because I liked his policies. I just, maybe God could slap him upside the head, you know what I'm saying, and stuff. And but the idea is Tom Homan, he's a national hero, and I think what he's done is absolutely fantastic. And I want you to think about how, and remember, I mean this sincerely, I want you to think about how dumb a lot of people are. Let me give you an example. I watch liberals scream about racism. Everything's racism, you know what I'm saying? And it's like, and they realize that name calling doesn't count anymore. You've been calling people racist since Obama, so it doesn't mean anything. It's just like calling people fascists and calling people Hitler. It's like crying wolf all over again. But here's the point. Do you understand that when they talked about the people that work in certain industries, they complain about corporations, but then they want to protect corporations for using basically cheap labor that have illegal aliens. Stop calling them undocumented. Do you know what I'm saying? It's illegal, okay? Undocumented doesn't make it sound better. They're here illegally. I don't care if it's Juan Valdez or Jose or whoever it is. I got a Mexican joke. It's kind of funny. You ready for it? So these parents had twin boys. The first name they named Jose. What was the second name? Jose B. Anyways, that's pretty funny right there. I don't care who you are. But see, someone's going to say I'm racist or something. I don't give a shit what you say. They say welcome to the world. But here's the point. They're like, it's making all things go up and we won't be able to afford it. Do you know who used to also say that? The slave owners. Slave owners said, we have to have this, otherwise we cannot afford to do our crops and everything. It's the same thing. So all the liberals scream about racism, and then they're saying if we get rid of the undocumented immigrants, aka illegals, it's gonna, we won't be able to afford and stuff like this. I'm like, that's what the slave owners said back in the day, and they don't correlate that. Okay. Anyways, my little rant. What was the question? Anyways, what were we talking about?
We had mentioned Dr.
Doc-
just like a praise to Dr. Jessica Jansen.
Oh yes, praise to yeah. And so anyways. All right, next one.
How long do you have to avoid gluten when it's on your allergy list?
Well, I think that you should avoid gluten, most wheat-based products for a significant time, especially if you have any autoimmune process. I think that there's other great grains that you can do that have a different form of gluten, but it depends on your labs. It really does. Depends on your inflammatory markers. And then if your CRP comes down, then you could probably introduce some things back in and see what happens.
What can I do about pelvic separation after birth? I'm still having pain a year after I gave birth.
If you're still having pain, I'd actually go get an ultrasound done, go to an OB, see if there's nothing extremely major it's in there. Then if not, go see either a physical therapist or a chiropractor to see if there's any structural or muscular thing that's still causing your pain.
Gray hair early, is it genetics or lack of nutrients?
I think the lack of nutrients and some infections started the process. And from what I understand, I don't know a lot about it. I've just seen that once you go gray, it's very hard to go back.
I had a stroke over a year ago. Can you get residual on the right arm numbness out of nowhere? Is that normal?
It's not out of nowhere. If it comes and goes, there's still a culprit that's actually causing it. because if it was permanent, if you had permanent nerve damage, it would stay there all the time. So if it goes away and comes back, goes away and comes back, you still have some nerve irritant there. It could be structural. Could be you could have inflammatory markers that cause the blood to get thicker, and that can relate to it that way. Find the inflammatory triggers if it's coming and going.
What do you think of high oxalate foods? Do you think they contribute to inflammation?
There's some people that do react to oxalates. I think that the overgeneralization that oxalates are bad for you. There's actually even studies that show that oxalates can have some benefit to some people that way. There's some people that do not tolerate oxalates well. There's a certain population that do not tolerate them. But you know how you actually make, when you properly process, I know it's a really voodoo world and the natural world, that's not really true. Everything is a little bit processed unless you're truly eating raw organic food. When you, like for example, like turmeric is high in oxalates, it really is. But when you actually prepare the herb, prepare it that way, there is a change and there's less effect from all the oxalates. There's other foods like chocolate and some of that. As long as it's prepared properly, processed properly, there's going to be less irritation from it that way. But there's some people that just can't tolerate oxalates. But just in general, everybody can't handle oxalates. That's not really true. There's oxalates do have actually a benefit too.
What do you recommend for someone who's a mechanic and is exposed to chemicals daily?
I would be taking milk thistle on a daily basis. I'd make sure that you are always supporting your body, and then when you cannot control certain things like being a mechanic, control putting other less toxins in and on your body. And then take milk thistle. Make your liver very healthy.
Can the scan at the wellness way show intestinal malrotation or blockage?
No, you need to go to the hospital or go to get some imaging done for that.
How old does a child have to be to get an x-ray done?
It depends. I had a parent that dropped their child and kind of rolled, and they were probably 2 weeks old. It all depends on the necessity. Just make sure that's, so I've done a 2-week-old and I've done a 105-year-old. So it depends on the necessity needed. It's like, it's like this. How old should you be if you break your arm to get surgery? If you broke your arm, it's needed. You say, and you just got to justify your necessity of doing something.
What are the benefits to taking copper?
Taking copper? Do I like people taking direct copper? You got to be careful because you can throw off your balances of other minerals. I like to see more eating copper-based foods and everything, but there is a hormonal benefit when you actually have good copper-based foods.
Any recommendations for malabsorption of nutrients, especially deficient in vitamin A, copper, and with celiac disease and EDS?
The person has celiac?
Yes.
That can be a little bit more difficult. Do the best you can to bring down as many irritants in your GI as possible. I would start by going a little bit more carnivore-ish and then taking proper betaine hydrochloride to help break down the amino acids and have a higher absorption, or a higher acidic process in the stomach, because then you're going to get better nutrient absorption. And then do everything you possibly can, chamomile, aloe, things to actually help repair and actually keep the irritation down in GI.
I'm trying to reverse my stepdad's diabetes with diet.
Yep.
He decided to take himself off of all his medications.
Ooh, be careful.
Is this safe?
Well, I don't think, that scares me, just because if you haven't done some change with your diet for a while, at least 3 months, stopping all your medication would scare the heck out of me, because you could put yourself in a hyperglycemic coma. You could do bad blood pressure problems. I don't know medications on, but I would never advise anybody doing that on their own or anything. I'd go back to your doctor that prescribed medication and say, here's what my plan is. Now, they may fight you a little bit. They may tell you stupid stuff like you can't ever get off your medication, which actually is a lie, but it's just saying, is I'd like to be monitored on my medication, and then as my blood sugar drops, could you wean me off of medication? I mean, the doctor prescribed it. Stopping medication like that is just a scary situation. You don't want to end up in a bad situation.
I've been anemic ever since I can remember. Aside from obviously eating meat, what can I do in addition to help?
Get some IVs of iron. Really honestly, get some IVs.
I read somewhere that someone had their doctor run an antibody test to see if all their vaccines are actually still helping them. Is this actually a thing, and are they talking about the boosters of childhood vaccines?
Well, here's what happens. If you think this way, they're trying to measure titers and stuff. But those can be misleading because they can go down and person still have an immune response. They're so focused on antibodies instead of true T cell production, which is no way to measure it. And so therefore, that's why they focus so much on antibodies. But I think that's a very, bad way of looking at things when it comes to your immunity.
Do you think eventually insurance companies will cover the testing you guys do, or just holistic healthcare in general?
I don't think holistic health will ever be covered, just because of the fact that you'd have to create a whole nother system, and everything is based on disease management, and it's multi-trillion dollars per year. They're not going to roll over. I'm very happy, and I actually think that RFK Jr. is going to be a monumental figure in our history going down with what he's got planned. Do I think that he's going to be able to do all of his agenda? Absolutely not. Not because he won't work 24/7 to make things happen. He's going to try to put the best people in place. It's just that what happens is this: there's too much money floating around to make big changes that way. And do you really think that people are going to do two forms of insurance? I don't think it would ever happen. So there's an old saying, in God we trust, the rest pay cash.
Our 29-year-old daughter was just diagnosed with Lyme's.
Yep.
What can she do? She is still breastfeeding her 10-month-old.
If you're just diagnosed with Lyme, I know people don't like me saying this. I believe that she's going to need a course of antibiotics that I think her doctor is going to prescribe her, and I think that she should take it. That's just my opinion, just because Lyme is a very devastating disease, and if you found it and it's active, you want to get on it as quickly as possible. And then you can do all the other things to help restore some things back and deal with the consequences of it taking the antibiotics. But I think that especially if it's an active infection, I think it's needed, because Lyme get out of control is a very lifelong, devastating thing.
Can you talk about stimming? You mentioned it
Yep.
on a reel recently,
Yep.
and my 10-year-old daughter flaps her hands
Yep.
when she's thinking about a complex idea.
Yeah. Well, here's what happens. This is, you guys probably know this, I've been stimming my leg the whole time here. It's like, you see, I bounce it. You understand that if you actually do this, everybody take their hand and shake it. Everybody right now, please do me a favor. I know you're going to look weird at your desk if you're listening. Shake it and then stop. Do you feel that right there? Proprioceptive stimulation. Do you understand that proprioception is very calming to the nervous system? So that's why you see these kids stim, because they're trying to, by nature, the body's trying to calm down and get them out of fight or flight and put them more in their anabolic state. And so that means they're being excitatory by something inside their body. I deal with that. Guys, listen, people don't realize this. Trust me, people post dumb shit on my Facebook all the time. This woman posted something really stupid, because whenever you talk about certain things that cause autism that way, they're like, well, if you're not a mom that doesn't have a child autism, you shouldn't even talk about stuff. I'm like, oh, are you really this stupid, ladies? Ladies, I mean this sincerely. Here's one thing I find out. If you're an account that's a male, it's usually a fake account making a bot or something on my stuff. Ladies, one thing you need to do, and I love you about this, ladies, you're extremely emotional, which I absolutely love. I employ more women than I employ men. I really do. And not just because it's a choice, just because they're qualified for their jobs. There's times I choose women over men, not based on their sex, but just they're qualified and they do a wonderful job. So, but I would say this, I always have to teach female employees, don't get emotional. Don't get emotional. Actually, honestly, it doesn't matter what it is. So all of a sudden, when you get emotional, you seem to vomit. Trust me, ladies, sit back, take a breath, check your medication and stuff like that. And then before you go post and stuff, because you look really stupid when you actually verbally vomit something out there because you're emotional and stuff like that. And the reason why I bring that up is this: if you have a question about something, when I post about something, just ask a question. I will answer things like crazy. And whenever you talk about things that women have suffer or have their child suffer or something that way, just because you don't like somebody's opinion, and I mean this sincerely, I want to bring this up. I mean this very humbly and sincerely. If you're defending the medical system like tooth and nail, and yes, I understand you might be a nurse, you might work for the health department, so therefore you're going to emotional because you cannot equate in your brain that you might be contributing something that's bad for the world. You understand? And now somebody like me comes along and says, yeah, health departments, you guys lie a lot. See, COVID brought a lot of that stuff out. You lie a lot. And then you're working for them. And instead of going, hey, there's some things that we are doing bad, just call it out. This is simple. It's like somebody makes a mistake in business. Just fix the mistake and go on. Don't sit there and beat yourself up. Now, if you try to defend the stupid position, I'm going to come after you and be like, you're stupid. You're an idiot and stuff like that. You're just a special kind of stupid and stuff. And so when you say dumb things, just think a little bit. You have a question, I'll explain everything possibly on here. And top of it, I mean, sincerely, you're on my pages, and your comments don't change what I'm going to do. So I just want to make that very clear. What else we got? Got time for a couple more.
Can I ask for blood work to see what vitamins I'm deficient in? My doctor says that's not how it works.
Yeah, your doctor's kind of right. There's certain things you can see you're deficient in. There's certain things you can't measure at all and stuff. And that's why I tell people you want to eat high micro, macro, and microbial dense foods, because then you will get the vitamins that you need. But there's only certain ones you can measure. There's certain labs you cannot measure certain things. So your doctor is right.
Can medicinal mushrooms stimulate the immune system too much?
They don't work that way and stuff. When you take a medicinal mushroom, your body takes the constituents, the bioactive ingredient, and performs certain functions. It's not a stimulant. It's not an inhibitor and stuff. That's like someone eating liver and saying, oh my goodness, my body responds this way. It's because it wants to respond that way to deal with something.
What do you suggest for kids with stomach worms?
Kids with stomach worms, acidify the stomach, because that acid-base balance will actually kill it. That's why it's very important to not suffer with hypochlorhydria, because that can cause a lot of digestive problems, including infections.
Going to do an elimination diet for eczema. Do
Yep.
you agree that 2 months is around the right length of time to determine if it's working? Does inflammation stay in the body that long?
I think that if you're going to do elimination diet, you can see results quicker than 2 months. But that's a good time period. I believe that you can see results within usually a couple weeks and stuff. Now, once again, a couple weeks still a short time, but I'm saying if you do a true elimination diet, if you go all carnivore for a couple weeks, people always see some benefit to their skin, weight, things like that, and then you can realize and work your diet around there. And yes, guys, it's Monday, so that means I'm back fasting. I'm fasting. I forgot to tell you guys, I'm fasting 5 days a week, every single week until the seminar. So I still have 10 weeks of 5. Is it 10 weeks? Yeah. It's 10 or 9 weeks left. No, I think it's 10 weeks of fasting till I'm going to do Monday through Friday. Well, actually Sunday night through Friday afternoon and everything. Except for that I'm actually quitting Friday this a little early because I'm going down by Faith and Devin, and Faith and I are going to go to First Watch. We'll grab some smoked hams, some pork sausage, and a coffee. So I'm only going to like 10 o'clock, but I'll be honest with you, in all my adventures that way. But now for the next basically 10 weeks, 5 days a week, I'll be fasting. So if you guys want to join me, it's not fun. It's hard. Just remember that. It's even worse when your wife is like a super cook. You know what I'm saying? It's like she's baking organic, gluten-free sourdough and doing all stuff and making lactation cookies and stuff like that.
Sorry,
and,
not sorry.
and all this fresh stuff at my house and making all this stuff, and it's pure punishment. You know what I'm saying? If it was, frozen pizzas every night, I think it would be okay. You know what I'm saying? But it's not in my household. So long story short, but pick something that's hard. You know what I'm saying? Now, ladies, I'm hoping that you don't fast. I'm hoping that you just focus on a lot of proteins. And men, I'm hoping you do join the fast with me. All right, one more question.
Oh, for just one more.
Well, you got two you want to ask, or?
Well, it was kind of just a follow-up.
Okay, follow-up.
Because we were talking about eczema. What helps with really bad eczema?
What helps? Nettle is really good. Cod liver oil is very good. But remember, those are just trying to calm down the immune response and stuff and get some fatty acids and get some vitamin A to the skin. You got to find the immune triggers. One more.
After I have a bowel movement, my stomach looks like I am 6 months pregnant.
Yeah.
What could that be?
There's microbial problems. You have some infections in there. It could be overgrowth of your normal flora or something that came from the outside. Get a stool test.
One more.
One more?
My period is trending down to like only 1 day of bleeding. I know this isn't a good sign. What could I do to help?
We got to find out if it's neurological or what age you are. You might be transitioning into menopause. So if you're a younger lady, there's something neurological that you're probably losing FSH and LH stimulation. Labs are very important, so get a thyroid hormone test done plus a Dutch test. But we got to find out if it's neurological or if there's actually you're just making a transition. All right? All right, guys. Wait, what are you laughing about? What you got?
Someone's talking about injecting honey. Like, is that...
Injecting honey? I've never heard of that and stuff.
Yeah, I'm not
Yeah.
sure. It says injecting honey. Is there certain honey, and how is the best way to take it?
I've never, remember, I'll never make a comment to everything I haven't had experience with that way. I've never known anybody to inject honey and stuff like that. If there's any research, you can send me. And also, you guys, if you have a question, please email me at pflynn@thewellnessway.com, pflynn@thewellnessway.com if you have a private question that you didn't want to say on here and stuff, and I will try to do the best I can. Me, Dr. Bryce, a bunch of other docs answer your questions that way. We get them all the time. I've never heard of injecting honey. I'm a very big fan of honey as far as a superfood. I think it's something that should be eaten on a regular basis.
It
But
might
the idea is
have
this.
been someone said she might have meant ingesting honey.
Oh, ingesting, yes. I think that honey will massively benefit a lot of people. Bee pollen, things like that. Bee propolis, it's all good stuff. Or is there something else you guys want me to comment on? You guys are very active today over there.
We're getting all the good ones coming
All right.
last second.
All right, well, we can
Okay, well,
go a
let's
couple more.
ask it. Okay, I've gone off of all of my antidepressants now because I felt
Congratulations.
it was making me worse.
Yep.
I felt like a zombie. What
Yep.
would you suggest I do, because I still have moments where I feel depressed?
Yeah, depression is a really significant thing, okay? First of all, here's what happens. Number one, make sure that you get at least 9 to 10 hours of sleep. Please, I beg of you, especially if there's any psychiatric thing going on, 9 to 10 hours of sleep. Try to get into bed between 9 and 10, okay? Second of all, try to reduce your high glycemic sugar-based foods. Third of all, if you're not taking any medication, take a little bit of St. John's, take some Bacopa, take some Mucuna, and some cod liver oil. Okay, but if you're off of medications, take a little bit of St. John's, but you can't take it with medications. Okay, but take a little bit of St. John's. Then what I want you to do is this. Okay, you need to move. You need to resistance train a little bit. Exercise is one of the greatest antidepressants never used. You need to exercise. Please, I beg of you, even if it's just a nice walk outside, I encourage you to go for a long walk outside, a long walk, not 100 yards, a nice long walk, okay? Be outside. Now, if you live like we do where it's cold, it's actually 40 degrees today, so it feels like summer right now, but get outside, you understand? Those things right there can help dramatically. Do not sit around. If you feel depressed, go exercise. If you're depressed, go move. Make sure you reduce your sugar. Make sure you add a little bit of brain support for the things I talked about. Okay? Great questions today, guys. We'll see you guys tomorrow.